tonight after that briefing by government, with the number of newly diagnosed COVID-19 cases spiking again. More than 17,000 new cases reported yesterday. Also an increase in the number of people who've passed away. 520 in a 24-hour period. Takes our overall death toll in the pandemic to 70,908. As far as vaccines are concerned, we've now passed the 7 million injections milestone. 210,000 shots given yesterday. 6.7% of South Africans have now been vaccinated. The number of active cases, though, goes up to more than 150,000. Gauteng and the Western Cape, still the highest numbers of active cases. Northwest has a higher number for that province of more than 24,000 cases. We last had more than 500 people passing away in a 24-hour period 8 days ago. But the number of people who passed away in this third wave is as high as past week's numbers reveal. Well, more developments in the last 24 hours around vaccinations. The Food and Drug Administration in the US says it's extending the shelf life of the Johnson & Johnson vaccine to 6 months. It comes ahead of us receiving millions of doses of the Pfizer vaccines from the US in the next few days. Well, from the latest on this, we're joined in our studio by Mia Malan, from the founding editor of the Bhekisisa Center for Health Journalism. Mia, good afternoon to you. Nice to see you in person, sign, I think, of our changing times. Our aim has always been to vaccinate 300,000 people a day. Some days we seem to get really close to that. Some days we seem to fall a little bit behind. What's causing the discrepancy? Why are we going up and down a little bit?
So, Stephen, last week you may have noticed we vaccinated more people than this week. This week the figures went a little bit down, and for instance, yesterday was the first day in about 2 weeks that we went under 200,000 jabs per day. Now we are geared up. The health department has enough sites. We've got about 3,000 sites. That includes either main sites or also places of workplaces to get vaccinations at. And so we can do 300,000 jabs per day. The problem is we don't have enough vaccines. And the reason we didn't have enough vaccines this week is because we've geared up. We now do more vaccinations per day, but we're still receiving the same number of vaccines per week, and actually also a little bit less. We got fewer Pfizer vaccines in July than we got in June. And what this week happened was that we also haven't received the J&J jabs that was released by Aspen this week. So Aspen handed it over to Johnson & Johnson, and Johnson & Johnson now needs to hand it over to the health department. They're hoping that that would happen tomorrow morning. But after that, it still needs to get tested. They can only test it at the National Control Lab once they've received the jabs. So we didn't have enough jabs to do 300,000 vaccinations. That is almost like the sole reason. It's not that we don't have the capacity. We do have many people turning out, especially because of the 35-plus group that are now coming in thousands and thousands for vaccinations. But some sites, unfortunately, did run out because of the lack of supply at the moment.
We've got more Pfizer vaccines coming this weekend. We've got the Johnson & Johnson vaccine doses you referred to. Next week, we should get closer?
Yes, we should. So we're getting 1.5 million Pfizer vaccines next week on Monday. And we're also getting, as you've mentioned, just above 2 million donations of doses for Pfizer from the US government this weekend. And the rest is supposed to arrive on Monday. Bear in mind that all those doses still we need samples to be sent to the National Control Lab. So we're probably looking rather that towards the middle of next week for things to go better. But yes, absolutely, we are getting in more. We do have a delivery schedule for Pfizer up until mid-August, 1.5 million, around about that every Sunday night. We don't have certain dates for beyond that, and we don't have certain dates for J&J for after this batch that we're going to get now. So it is all up a bit in the air, and I think the health department is really waiting for certain dates from all the companies.
Sunday night is vaccine night at Tambo International, it would seem.
Well, for Pfizer it is, yeah.
For Pfizer. The bottleneck has been getting doses. Government seems fairly confident, the President's fairly confident, the Acting Health Minister's fairly confident, you're fairly confident that we're getting more. So then the bottleneck would become getting those doses into people's arms. And that's actually a much more complex process in some ways than getting the doses in the first place.
So we have been distributing, obviously, doses nationally. If we look at it, it's interesting when you look at rural provinces, for instance, because most of them were geared up for J&J jabs because you only need one vaccination, and it's harder in rural areas where distances are further to travel, for instance, to sites and that sort of thing, than in urban areas to follow up with people for a second jab. So if you look at a province like the Northern Cape, for instance, they haven't even done 200,000 vaccinations. And part of the reason for that is because almost every single site was geared for J&J, and then J&J didn't arrive, and they had to convert to Pfizer sites, different types of storage requirements. But if you look at which province proportion-wise is doing the best in the country, it's a rural province, it's Limpopo. And they have obviously managed to work around this. And part of the reason why many researchers say they've been doing so well is because they've been using community leaders so well. They use church leaders and traditional leaders to get people vaccinated, but also to get them registered. And in many villages, there are traditional offices that have been turned into vaccination sites. So that is something to be learned from many provinces. But, you know, a province like the Eastern Cape is, for instance, also doing pretty well in terms of numbers and proportions. The proportion of adults that we vaccinated in South Africa is 6.7%. So those are people who either got one J&J jab or 2 vaccinations for Pfizer, so they're fully vaccinated. And the Eastern Cape is a rural province and is above that. They're around about 7%. So it depends on which province you're talking about. Northern Cape and Mpumalanga haven't managed in terms of numbers, not proportions, to do as many vaccinations as the rest of the country.
This is one of those scientific things where the definitions really matter, because we can talk about the number of injections. So we talk about, you know, 240,000 injections given on a particular day, but that doesn't mean that those people are fully vaccinated. There are actually different numbers and different categories.
Absolutely, and it doesn't even mean that even if you talk about people who've only had one Pfizer vaccination, that number doesn't even equal. So if you look at last night, yesterday we passed the 7 million mark for how many doses we've administered, but only 2.6 of those million people have been fully vaccinated. And even if you look at the 7 million doses and include all the Pfizer different doses in there, you would be double counting some people, because some people have received 2 Pfizer jabs. So if you see 7 million doses that we've done, it's really not something that you can translate to the number of people. So you can't go and take those number of doses and say, this is the percentage of people that we vaccinated. You need to know who you've fully vaccinated. You need to take how many second Pfizer jabs we've done and how many J&J, and you count that together, and then you get to 2.6 million.
Okay, and then within that, there's weekend vaccinations. We've seen that being very slow. I think it was the acting health minister who said that that would start to increase. Is it really going to increase? Do we really have the capacity to sort of vaccinate at this rate 7 days a week?
So we have enough sites and we have jabs coming in, but the problem that we're facing is to have staff to do that. And the health department, I spoke to them this morning and said that we're supposed to start with widespread vaccinations on the 1st of August, but that is likely to go slower than what we expected, because they put out an ad for service providers, in other words nurses, and to help to vaccinate, and they didn't get a great response. So they don't have enough people to staff all the sites over weekends. We do have 5,000 volunteers that the acting health minister announced last week, but that's not nearly enough. You need about 4 people to staff a vaccination table at a vaccination centre. So it's not enough people. They're hoping that maybe between the waves, so between the 3rd wave and the 4th wave, there will be more people who are interested, health workers, because they wouldn't be so occupied with COVID patients. That takes up all their time. They're tired. So hopefully they are hoping that there would be more people available to that they can contract over weekends, because we've got a budget to do that now, but we don't have enough people who've offered their services.
Sure, there's a lot to consider there. You would have thought at the beginning of this that there would be an urban bias, that people in urban areas would start to be vaccinated. You would have a greater chance, let me put it like that, if you lived in an urban area of being vaccinated. If you live anywhere close to Sandton, the chances are a very big medical aid is going to take care of it for you. But when you talk about Limpopo, it doesn't seem to be the case. But is there a risk that some people in some provinces, maybe in Mpumalanga, maybe Northwest, just some examples, might almost get left behind? I mean, there's some places in Northwest that don't have South African cell phone coverage.
So I think we were all surprised, and the health department also mentioned that they were surprised when they looked at registrations initially on the EVDS, and more people in rural areas of Limpopo registered than, you know, people in urban areas. And the only reason how they could justify that or figure it out, they're still not sure about the reason, but was really the community leader involvement in Limpopo. But I think the crux of the story is, and that happens in other countries as well, is that if you take the vaccinations to the people, so if you do mobile sites, you get many more people who start to vaccinate, including in rural areas. And that is starting to happen now. We do have mobile sites. You know, a lot of our J&J vaccines that were supposed to be used for essential worker groups, such as teachers and other essential worker groups, didn't get used as fast as the health department thought it would get used, because there was so much admin involved. You know, you need to prove that someone is a teacher, you need to get them registered in a different way. So because those doses will now expire on the 11th of August, they've started to distribute them to beyond essential worker groups, to what they call community programs. So you may have heard, for instance, in Gauteng there are some drive-through sites. That's, for instance, one is run by a mosque, and that would be a community program that now has some of those J&J doses. And some of those doses are now also taken directly to people in rural areas. And it's mainly where we are going to use the J&J doses in rural areas.
It's fascinating to watch. Also fascinating to watch. You and Bhekisisa have a brand new TV show coming to Newzroom Afrika.
Yes, we are, and we're very, very excited about it. It will launch in mid-August. And in our first program, we have managed to secure an interview with Anthony Fauci, who is the US President's main advisor, and we're very excited to bring him to our show and to also talk about vaccine inequity.
Mia Malan, thanks very much.